I grew up in a medical family. My father was a doctor, and he was very traditional, and he was a very, very kind, loving man, but he did have this 1950s Marcus Welby approach, which is essentially a paternalistic approach to medicine. We will tell the patient what he or she is ready to hear, what he or she needs to hear, and most important, what we think they should know. And of course, in my generation, we moved away from that idea to say, no, the patient is a participant in their care, and therefore it's not for me to decide what they should or shouldn't know. My job is to tell them everything that's going on with them that might be important to them, but to tell them in a way that they can understand it so that they can then let me know how they want to go about their decision-making process. As I continue to practice medicine, and I've been at this for over 20 years, I continue to learn from my patients. They teach me things, and I have to be better about hearing what they're telling me so that I can then, going forward, communicate in a more accurate and positive way with my patients. How literally women take that information and how that might actually cause a lot of anxiety, distress, or all-out panic. So when I told you that your procedure would take roughly 2 hours, and we rolled off to the operating room at 7:30 in the morning, well, we roll off at 7:30, but by the time we get things ready, by the time we get started, and most important, by the time that you come out of anesthesia enough to really focus on the clock, it may even be 4 hours later. And because I hadn't communicated that to you, you looked at the clock and thought, oh my God, I have cancer. I think a lot of times people are reluctant to bring up something that's bothering them because they think that maybe it's not important and they don't want to be perceived as a whiner or complaining. And I like to cut right to the chase because, quite frankly, even if that symptom wasn't important, which it so happens it was for you, but even if it wasn't important, the fact that you were thinking about it and that you brought it up meant that it was important and meant that it should be addressed. We are told to teach the medical students how to deliver bad news. And what I have found over the years is that's not something you can really teach. People either have a way of empathizing and talking to people or they don't. Having said that, there are words that you can use and there are ways to soften the bad news. For example, when I did obstetrics, you don't go into the room and say, hi, the baby's dead. It's just not the way to give bad news. The way to do it is to walk in and say, I have something serious we need to sit down and talk about, and then you use words that get the message across. You have to say what's true, but there are ways to say it that is not alarming, that gives hope, and most important, a plan. Sometimes I have the luxury of working with outside doctors that I do have a relationship with. And in your case, the mammographer that you saw is someone that I refer to on a regular basis. So she did call me and she said, is this someone that you know well? And of course I said, yes, I do. I would like to talk to her. If it had been someone that perhaps she'd had more of a relationship with, that she'd been seeing for years, and I had only met once, then she might have called to give the news. Too often, though, someone goes to see someone outside that I have no relationship with, and then I don't know. And I get a report on my desk, and I'll call the woman and say, I see that you have an abnormal mammogram and you need a biopsy, and she'll tell me, oh yeah, that happened a week ago and I had the biopsy and I have cancer. And I feel terrible that I wasn't able to be there for her and participate. So in a perfect world, doctors would communicate and we would all gather together to figure out how best to deal with these issues. Physicians are human. And certainly when there is a patient who we have a relationship with, that we know, that we like, and we hear that they have something bad that's happened to them, it certainly affects the physician, it affects me. If I have someone who I've known for 15 or 20 years, and I hear, and I've delivered their children and I've taken care of them, and then I hear that they have a potentially fatal cancer, this affects me profoundly, the same as it would a friend or a relative that you hear is ill. You have to maintain your professionalism, you have to maintain your objectivity in terms of giving recommendations, but that doesn't mean that you don't feel. Have I ever cried? Yes. Have I ever cried with a patient? Yes. Does it happen with every patient? No. You know, certainly there are some patients that I have a more of a personal relationship with than others.